Hi guys, it's me, Professor D, and welcome back to my YouTube channel. I'm doing something a little bit different, okay? I'm going to be going over a short case study. There's only about 3 or 4 questions about a patient with bipolar disorder. This is going to be live. So I decided to go ahead and record it so I can post it on my YouTube channel so you guys can watch it. If you want to go back and take notes about anything I said or that I referred to or something you need to go back to, you'll be able to do that. So this is the first time I'm doing it. I'm just trying it out. Let me know what you think in the comment section. If you love it, you hate it, there's something you think I can do differently, let me know. I am not technologically inclined, so I'm trying my best here. So please be kind in the comments, but I definitely look forward to hearing your comments and suggestions. All right, guys, without any further ado, let's get started. Okay, so this is the case study on a patient with bipolar disorder, right? We have the subjective data, we have the objective data, and we have the physician's orders. The subjective data, this is what the patient is reporting to you. It's not something that you can measure, it's not measurable. However, objective data, that's something that is measurable, okay? And then below we have the physician's orders. So let's see what's going on. The patient's chief complaint, the patient states, I feel like I could do anything, but sometimes I just can't get out of bed. History, diagnosed with bipolar 1 disorder at age 25. History of poor medication adherence. Recent stress due to job loss. No suicide attempts, but has expressed feelings of worthlessness during depressive episodes. Social history, married, no children, occasional alcohol use. Family history, mother has a history of depression. Objective data, vital signs, temp 98.6, heart rate 110, blood pressure 140/88, respirations 20 breaths per minute. Mental status exam. It shows during manic episodes, the patient has pressured speech, grandiosity, ideas of grandiosity, distractibility, flight of ideas. During depressive episodes, the patient will have a flat affect, psychomotor retardation, tearfulness. Currently appears hypomanic, pacing around the room and laughing inappropriately. Look at the doctor's orders. The orders say that the patient is to start lithium, 300 milligrams by mouth 3 times a day. We're to get a baseline labs, CBC, electrolytes, thyroid function tests, renal function tests, and lithium levels. We're to provide psychoeducation about bipolar disorder and the importance of medication adherence. And the patients to be referred to an outpatient psychiatric service care for follow-up care. Okay? That's what we're looking at. Before we even get into the questions, a couple things I want to bring to your attention. Chief complaint, I feel like I could do anything, but sometimes I just can't get out of bed. That is characteristic of bipolar disorder. When the patient is in the manic phase, they're going to feel like they're on top of the world. Safety is a very big issue because they take a lot of chances, right? They feel like they can do anything. And then you have the opposite when they're on the other side of the spectrum. They're not manic, they're actually depressed, they're sad. They don't even have the energy to get out of bed. So when you're in the manic phase, you feel like you could run a marathon versus the depressive stage or phase where you don't even have enough energy to brush your teeth. History, where you see patient has a history of poor medication adherence, that is very common in bipolar disorder, getting the patients to stay on their meds, because what happens is the patient will be in the depressive stage and they start to feel better. And then they go to the manic phase. And again, they're on top of the world. They feel like they're invincible and they feel like they don't need their medications anymore. So they're up, down, right? Family history. When it comes to not only bipolar disorder, but all psychiatric disorders, we see a very, very, very strong genetic link. Okay, in almost all, and I'm saying almost just because I'm being careful, but I'm telling you it's pretty close. In almost all of the psychiatric disorders, there is a very strong genetic link. What else did I want to bring to your attention? Okay, let's before we get to the questions, let's talk about what you think Hold on, guys. Did you guys freeze on the live? Okay, good. Thank you. I see all the hearts. Thank you, guys. Everyone that's interacting and engaging in the live. Thank you. Let's talk about let's go to the questions because I forgot what I was going to say. Oh, nursing diagnoses. Very quickly, like you're going to prioritize the patient's physiological integrity. So I'm telling you now, when it comes to bipolar disorder, you're going to be concerned about safety, you're going to be concerned about nutrition, and you're going to be concerned about fluid intake. Okay. When that patient is on their high and they're going and going and going and going, they're not stopping to rest. They're taking a lot of chances that can put them in bodily harm. They're not stopping to eat or drink. That's why it's so important. You're going to be giving them finger foods. You're going to give them bottled water so they can eat and drink while they're on the go. While this patient's in the depressive stage, they don't even have the energy to get up and brush their teeth or wash their face. They're not going to have the energy to want to eat. So either way, guys, physiological integrity is always going to come first. Okay. And safety, of course, is going to be an issue, but it's going to be an issue in a different capacity. And it's going to be an issue where you're concerned about the patient having suicidal thoughts, because remember, depression, what is depression? All depression is anger, hostility, resentment, all those bad feelings, but it's not turned outwards. It's turned towards self. The world would be a better place without me. I don't even need to be here. Okay. All right. So the first question, well, let's go to nursing diagnosis. Remember, risk for injury, that's going to be a priority, especially when the patient is in a manic phase because they're very impulsive. They've got hyperactive tendencies. Imbalanced nutrition because they're not stopping to eat. Imbalanced fluid and electrolytes, they're not stopping to drink, and of course, ineffective coping because of their mood instability. I'm telling you right now, if you get a test question and they're asking you about your priority and it's between nutrition and fluid and electrolytes, every day of the week, what are you guys going to pick? What's going to be a priority if you have to choose between nutrition and fluid and electrolytes? Come on, guys. Very good, fluid and electrolytes, because guess what? Lack of fluid and electrolytes, that dehydration will kill you faster than lack of nutrition. Okay? All right. Now, here's the first question. Please listen carefully because I haven't figured out how to have this and questions on the screen. If anyone knows in the comment section, please let me know and I'll follow your directions. But for now, this is what we're going to do because I don't know any better. Here's the question. Listen carefully. The nurse is reviewing the physician's order for lithium. Which laboratory result would require the nurse to question the administration of lithium? Would it be a potassium of 4.2, serum creatinine of 2.1, a sodium of 140, or a hemoglobin of 13.2? I'm going to repeat the question and the options. The nurse is reviewing the physician's order for lithium. Which laboratory result would require the nurse to question the administration of lithium? Would it be potassium of 4.2, serum creatinine of 2.1, sodium of 140, or a hemoglobin of 13.2? This is interesting, and I'm so happy I chose this as a question because everyone, almost all of you on the live, except for one person, went with sodium. Guys, you have to be careful. Do you see what I just did here? I threw in sodium because you know that when a patient's taking lithium, you have to pay attention to the sodium level. If the patient's hypernatremic, they're going to get a subtherapeutic level of sodium. If the patient's hyponatremic, they can go into lithium toxicity. You know that. So because you know that, you saw lithium and you jumped to it. What did I say that lithium level was? 140. What is the normal sodium was 140. What is the normal sodium level? 135 to 145. Why are we concerned that the sodium level is 140? There's nothing wrong with that. It's smack dab in the middle of normal. You can't just see the word sodium and jump to it, guys. This is where your critical thinking comes in. Right? So there's nothing wrong with the sodium. The sodium's normal. Now, if the sodium was outside of the normal parameters, then we would be concerned for the reasons that I just explained to you. So now that we know sodium is not the answer, let me repeat the other choices. Tell me what you think the answer is. Would it be potassium of 4.2? Would it be a serum creatinine of 2.1? Or would it be a hemoglobin of 13.2? What are you going with? Very good. That's what you should have went with at the beginning. The creatinine, it's high. What are we concerned about? Kidney function. What is the job of the kidneys? The job of the kidneys is to excrete the drug, right? So imagine you're giving lithium to a patient and their kidney's not functioning properly. So instead of getting rid of that lithium like their body's supposed to, it's building up and building up and building up. And guess what? You messed around and threw that patient into lithium toxicity. Okay. All right. Let's move on to the next question. There are 4 questions in total. Okay. Question number 2. Listen closely. Which nursing intervention is most appropriate for a patient in a manic state? Would it be A, encourage participation in group activities? Would it be B, provide a low stimulation environment? Would it be C, promote high energy snacks? Or would it be D, allow the patient to make decisions independently? I'm going to repeat that. Which nursing intervention is most appropriate for a patient in a manic state? A, encourage participation in group activities. B, provide a low stimulation environment. C, promote high energy snacks. D, allow the patient to make decisions independently. And guys, the correct answer is B, low stimulation environment. Remember what I told you is happening with the patient. They're going to the point that it can change their physiological integrity. We need to what? Try to bring everything down. Provide low stimulation environment. Yes, you want to provide high energy snacks. And even more important than that, well, not more important than that, but high energy snacks, and they need to be, their snacks and meals need to be finger food because they're going to be on the go. We're trying to get them to slow down. Low stimulation. Very good. This patient with bipolar disorder that is in the manic phase, are you going to give them a roommate or are they going to be in a room by themselves? They're going to be in the room by themselves, right? They will talk that roommate's head off. Are you going to have that patient near the nurse's station or down the hall? Down the hall. Very good. Okay. And choice D, where it said allow the patient to make decisions independently. When the patient's in the manic stage, remember, they think that they're invincible. They're very, what's the word I'm looking for when someone makes decisions at a whim? Guys, what's the word when someone makes decisions by the whim? They don't think about it. Impulsive, not compulsive, impulsive. Thank you. They're impulsive. The reason you're going to have the patient down the hall and not near the nurse's station is because we want to decrease stimulation. Guess what's happening at the nurse's station? Nurses are talking, healthcare providers are talking, family members are voicing their complaints, the phone's ringing. It's very noisy, it's disruptive, right? There's a lot of stimulation near the nurse's station. So you want them down the hall where it's more quiet. We're trying to decrease stimulation. You're going to make sure that the room has very low lighting. You're going to make sure the TV's not on, the radio's not on. We don't want them to be overstimulated. They're already overstimulated. Okay. Question number 3. Can I move on? You're welcome. Question number 3. What teaching points should the nurse include when educating Ms. Taylor about lithium therapy? A, increase your sodium intake to prevent dehydration. B, avoid drinking more than 1 liter of water per day. C, you will need regular blood tests to check your lithium levels. Or D, stop taking lithium if you experience nausea or diarrhea. I'm going to repeat that. What teaching point should the nurse include when educating the patient about lithium therapy? So you're educating the patient about lithium therapy. Which point should you include? Here are your options. A, increase your sodium intake to prevent dehydration. B, avoid drinking more than 1 liter of water per day. C, you will need regular blood tests to check your lithium levels. Or D, stop taking lithium if you experience nausea or diarrhea. All right, most of you guys on the live, you chose the correct answer. You'll need to get regular blood tests to check your lithium levels, right? Because lithium has a very narrow therapeutic range. You guys need to know what that range is, 0.6 to 1.2. 0.6 to 1.2. Your textbook may differ by a point or two. So go by your textbook, but generally speaking, it's 0.6 to 1.2. Once that patient has hit 1.4 or higher, they're in what? Lithium toxicity. Okay. So the wrong answer choices, increase your sodium intake to prevent dehydration? Absolutely not. I told you what happens when the patient's hypernatremic. We need to keep the sodium level between 135 and 145. So we're not going to say that. Option 2, avoid drinking more than 1 liter of water per day. We want the patient to be hydrated, right? Because dehydration will cause us issues with what? That lithium level. So we're not going to say that. Choice D, stop taking lithium if you experience nausea or diarrhea. I thought I was going to trick a lot of you guys with choice D, but I didn't. I'm very proud of you. Let's talk about D. Stop taking lithium if you experience nausea or diarrhea. I wanted you to see nausea and diarrhea and jump on it because patients who are taking lithium, you're going to be watching out for nausea, diarrhea, tremors, confusion. Why? Those are signs and symptoms of lithium toxicity. What you're going to teach that patient is to report any of those symptoms. If they experience any of those symptoms, hold the next dose. Don't stop taking it. Hold that next dose and notify us immediately so we can notify the healthcare provider. Remember, we're dealing with a patient that's already non-compliant, right? And especially when they're in the manic phase, they're on top of the world, they think that they know best. Do you think that's a good idea to even give them the option of just stop taking your meds? Absolutely not. But if that patient's on lithium, you better believe we're going to be checking their lithium levels often because we want to keep that therapeutic range 0.6 to 1.2. And we're going to be checking the sodium level often. We wanted the sodium to remain between 135 and 145. I want to know if you do private tutoring, please. Yasmin, I do. I offer private tutoring. Just go to my website, nexusnursinginstitute.com, to book me. However, I book very, very, very quickly. To be honest, from what I've been told from other students I've tutored, they'll go on my website to book me around 2, 3 o'clock in the morning. And it works. So that's just what I've been told. But if you go to my calendar and I'm booked, just keep checking. If you find an opening, take it. I book very quickly. All right. Last question. One more. Winnie Brown 891 said, yep, she ain't lying. Here's the thing. It's only me. I'm one person, and there's like thousands of you guys. I'm sorry. Okay, last question. The patient expresses concerns about taking the medication long term. What would be the nurse's best response? Is it A, you can stop the medication once your symptoms improve? Is it B, the medications help to prevent extreme highs and lows of bipolar disorder? Is it C, your doctor can prescribe the medication only during manic episodes? Or is it D, It is your decision whether to take the medication or not. I'm going to repeat that one more time. We're still talking about, lithium, which is a mood stabilizer, guys. The patient expresses concerns about taking the medication long term. What is the nurse's best response? A, you can stop the medication once your symptoms improve. B, medications help prevent extreme highs and lows of bipolar disorder. C, your doctor can prescribe the medication only during manic episodes. Or D, it is your decision whether to take the medication or not. Very good. The answer is B. I saw you guys were stuck between B and D. So let me repeat what B is and let me repeat what D is, and we're going to compare the two, okay? B says your medications help prevent the extremes of highs and lows of bipolar disorder. And D says it's your decision whether to take the medication or not. Here's why you would not choose D. Even though D is true, it is your decision, right? Unless you're you have some type of mental incapacity that you can't make decisions for yourself, it is your decision. Even though it's true, is it the best answer? Absolutely not. You're saying to the patient, well, it's your decision, it's your decision to take it or not. It's true, but you're not helping them. Why? Because you're not educating them. But B, you're educating them. You're letting them know these medications help with the extremes of the highs and lows. So number one, you're educating them. And number two, you're encouraging what? Medication compliance. Right? Do you see the difference between the two? And NCLEX will do that to you guys. NCLEX will give you 2, even 3 answers that are absolutely correct. But just because it's true, is it the best answer for your patient? Is it the best answer for the situation that's provided? Okay. You always want to give the most therapeutic response. So guys, those were the only questions I had for this case study that you're looking at. Just a couple things I want to bring to your, just remind you, when it comes to bipolar disorder, you need to know the differences, when the patient's in the manic phase versus the depressive stage. You need to know the nursing interventions. You need to know, and for this one, I just talked about the manic stage. I'll do another one on the depressive stage because there's some important drugs you guys have to know about. But anyway, you guys got to know the lithium level. You guys got to know the sodium levels and how they affect each other. You need to know the signs and symptoms of lithium toxicity. The patient is in the manic phase. You're still going to assess them for suicidal thoughts. I don't want you guys to think that you won't. It's just more likely when the person is in the depressive stage. But with both extremes, you're still going to assess that patient. You're going to teach them about the importance of eating, drinking, and sleeping. Physiological integrity. Remember, guys, that is going to be your number one priority. And of course, if in the question that patient is in an inpatient unit, they're being discharged, you have to send them home with support. Okay. Number one, you are not going to send them home with a 90-day supply. I've seen NCLEX do that where they tell you, the patient's being discharged home, is there anything wrong, anything that you do? Why would you call the healthcare provider? And they give you a list of stuff going on with the patient. And one of the things they put on there on the discharge list of medications are antidepressants, 90-day supply. Are you kidding me? 90-day supply. This patient who was in their high, they were in the manic phase, could be in the depressive stage, and now you just gave them a 90-day supply. What do you think they're going to do with those drugs, right? So no, whatever stage that patient's in, you're only going to give them at top 3-day supply. Why? They need to follow up with their healthcare provider. We want to make sure they don't off themselves when they leave, so we don't give them that ammunition. We're only going to give them a 3-day supply and make sure that they follow up with their healthcare provider outpatient. Yes, Dira, I didn't even think about that, but you're absolutely right. I've talked about this on several other videos. When it comes to the patient with depression, you definitely need to know the positive symptoms versus the negative symptoms. I didn't talk about it here because, again, I'm going to do another video on depression itself because that's, a story for another day, but absolutely, you're correct. Okay, I'm going to answer more questions. If you guys have questions on the live, let me just wrap up this video and then I'll be with you guys in a second. All right, everybody that's watching this video, let me know what you thought about this video. Let me know if there's something you'd like to see me do differently. Remember, I'm not technologically inclined, so if there's something you want to see me do differently, please tell me how to do it and I will be glad to do it. Let me know in the comment section what you guys thought. Please be easy on me. Be kind. I want to hear from you. I can't respond to everyone, but I do read all of your messages on YouTube. So go ahead, let me know what you think, and I will try to improve this. If I'm even going to do it again, I'll try to improve it. Thank you so much for watching. You guys will catch me on the next video.